I'll be talking about results of atlantoaxial fusion for reducible atlantoaxial subluxation in rheumatoid arthritis. For reducible atlantoaxial subluxation, AAS due to RA, we primarily perform C1-C2 fusion. In the beginning, Brooks wiring was introduced in 1982, and translaminar screwing major procedure was introduced in 1992. Subaxial subluxation, SAS after C1-C2 fusion is still a difficult issue to predict. The purpose of this study was to evaluate the clinical results of C1-C2 fusion in RA patients and to clarify the incidence of SAS after C1-C2 fusion and the relation between the occurrence of SAS and C1-C2 fusion angle. We retrospectively reviewed 68 patients who underwent C1-C2 fusion from 1982 to 2005. There were 36 patients who underwent Brooks wiring and 32 patients who underwent major procedure. Average age at operation was 60 years old. There were 51 female and 17 male. Average duration of RA was about 12 years. Surgical indications were myelopathy in 29 patients and radiculopathy in 38 patients. Only one patient was operated for significant instability without any symptoms. Improvement of myelopathy and pain, survival rate using Kaplan-Meier method, fusion rates were evaluated. The incidence of SAS and collapse of vertebral body occurred after C1-C2 fusion, and the rate of second surgery due to SAS were investigated. To know risk factor of SAS after C1-C2 fusion, its relations to post-operative interlaminar fusion at C2-3 and C1-C2 fusion angle were investigated. 17 patients out of 29, 59% demonstrated neurological improvement. Pain disappeared or reduced in all patients except one. 14 patients, 21%, died before the final follow-up. 5-year survival rate was 89%, 10-year rate was 69%. Fusion rates were 91% in Brooks wiring and 100% in major procedure. Post-operatively, SAS occurred in 12 patients, 24%, and vertebral body collapse occurred in only one patient. 6 patients presented myelopathy due to SAS and underwent second surgery. Post-operative interlaminar fusion at C2-3 occurred in 11 patients, 22%. It might be a risk factor of SAS, but it was not related to the occurrence of post-operative SAS. Between C1-C2 fusion angle and the occurrence of SAS, there was no relation. Hyperlordotic fixation seemed to be a risk factor of SAS. It had no relation to the occurrence of post-operative SAS. Average lifespan of RA patients in Japan was reported to be from 62 to 65 years old. In our institute, 5-year survival rate was 80% after OC fusion and 89% after C1-C2 fusion. And patients lived longer than ordinary RA patients after surgeries. Egawa reported 5.5% underwent second surgery after average 9 years follow-up. Clark reported the rate was 21% after 8 years. In our study, the rate was about 9% after 6 years. Several authors reported hyperlordotic fixation of C1-C2 led to kyphosis of subaxial spine, and Ito reported the increase of C1-C2 fusion angle was correlated with a decrease in C2-C7 angle followed by SAS. In our study, fusion angle of C1-C2 was not related to the occurrence of post-operative SAS that was supposed to be associated with state of RA disease. Conclusion. Clinical results of C1-C2 fusion were satisfactory. After C1-C2 fusion, about 9% of patients underwent second surgery due to SAS with myelopathy. After 6 years, C1-C2 fusion angle was not related to the occurrence of postoperative SAS. Thank you very much for your kind attention.